Thanks for watching. Let's talk about St. John's wort. St. John's wort, or Hypericum, Klamath weed, goat weed, Latin name Hypericum perforatum, widely used throughout the world for mild to moderate depression. Used here in the United States quite frequently, but in Germany it actually outsells Prozac by a ratio of about 4-to-1. It's named after St. John the Baptist because the plant blooms about the same time as the feast of St. John the Baptist. The medicine's been used for over 2,000 years. It's one of the most extensively studied of the different herbs. Now, historically, it's been used for a lot of other medical issues outside of depression. It's been used for hot flashes related to the menopause or kidney ailments, insomnia. It's been used for wound healing and attention deficit disorder and obsessive compulsive disorder, and anxiety and irritable bowel syndrome, helped to get off cigarettes. It's been used for neuropathic pain and chronic fatigue and seasonal affective disorder and wound healing and peptic ulcer disease, and used for sciatica. Don't have great evidence that it works for those conditions, but for depression there seems to be some good evidence. The sales in the United States peaked at about $300 million in 1998, down somewhat since. But in Europe, it sells in the billions of dollars. Here in the United States, it's a dietary supplement. It is not considered an FDA-approved medicine, and it's not an FDA-approved over-the-counter agent. But it's still widely used as a treatment for mild to moderate depression. The dose is standard, 300 milligrams 3 times a day, for a total daily dose of 900 milligrams, but it seems to be effective for some people in a dose as low as 500 milligrams to a dose as high as 1,200 milligrams total dose per day, although some people are now pushing it up to about 1,800 milligrams. Question is, what's in the bottle that you buy, the amount of the active ingredient, is unknown. There's the quality of the extraction product, the method of extraction. Is it with ethanol? Is it with methanol? What was the season like when the material was harvested? How long was the plant dried? What kind of extract is used to consider the active ingredient? Well, if we look overall at all of the St. John's wort that's being sold, there's significant variation from bottle to bottle, manufacturer to manufacturer, so much so that some bottles have no active ingredient, others about 20%, others up to 140%. Well, Consumers Lab did a study, and they found that 60% of the supplements contain far less material than was on the label, and it's often adulterated with different kind of drugs, with chemicals that give it the reddish color, and with herbs that are inferior that are used to cut the product. There's no consensus, as I mentioned, regarding even what the active ingredient is. Now, the genus is Hypericum, and that's from the Greek. Hyper means above, ichno means an icon or a statue. Wort is just simply a term that's used for any plant or herb or root or crop. The ancient Greeks and Romans hung them above images in the home, supposedly to ward off the evil spirits. The product is native to the temperate parts of Europe and Western Asia and Northern Africa. It's brought to the United States and all around the world. Now it's considered a noxious herb or a weed in more than 20 countries, but it's grown commercially in southeastern Europe. It's actually the combination of two closely related plants, Hypericum maculatum, Hypericum attenuatum. They hybridized in Siberia and then spread throughout the world. It's grown widely in plains and pastures and fields, but once it gets into the fields, it can replace the native plants and make the land non-usable for agricultural purposes. And then when it's ingested by livestock, by horses and sheep and cattle, sometimes there's photosensitivity or depression and spontaneous abortion and even death. The material used to make the extract are the flowering tops of the St. John's wort, used to prepare teas and tablets and capsules and liquid extracts and topical preparations. The active ingredient is the issue. We don't know what the active ingredient is. So is it the flavonoids like quercetin or epigallocatechin, or is it the phenolic acid like vanillic acid or caffeic acid? Or is it the hypericin or another product known as hyperforin? Or is it the tannins? Or is it the volatile oils? Or the saturated fatty acids? Or the alkanols? Or the vitamin A type derivatives? Nobody knows. There are a variety of other products in there as well. In order to sell the material, it's sort of been agreed that it should be standardized to 0.3% hypericin. That's how much active ingredient should be in the plant. That's present in the material, but whether it actually is the active ingredient is unknown because there's no correlation between the concentration of the hypericin and its antidepressant activity. So there's another product known as hyperforin, and the hyperforin seems to be a product that was once upon a time thought to be totally inactive, but now it's thought, well, maybe that's the active ingredient. The way the hypericin supposedly worked is it supposedly was an MAO inhibitor, and it supposedly had something to do with altering the sodium transport into and out of the cells, which meant that it would block the reuptake of serotonin and some other products. Well, that was okay, but then they found that the hyperforin, well, that inhibited the neuronal uptake of serotonin and norepinephrine and dopamine and a variety of other substances, so it seems to work sort of like the standard selective serotonin reuptake inhibitors, Prozac and Paxil and Zoloft and Celexa, but maybe even has a broader spectrum of activity. It also might work on the calcium channels. Now, in about the 1950s, it was studied with regard to depression, and that's when they found that the hyperforin might be more important. So in a standard 300 milligram tablet of the extract has about 15 milligrams of hyperforin. The maximum concentration is about 3 to 4 hours after you consume the product. At 4 hours, it has maximum change in the electroencephalogram, so we know it does something, and it's eliminated with a half-life of about 9 hours. There's little information about whether it's safe to take if you're pregnant or if you're breastfeeding, and as with all medicines or all compounds, we know that it might have some side effects, but fortunately the side effects taking the St. John's wort can appear to be considerably less than the side effects that you would get if you were taking a prescription antidepressant. So yes, you could have some tiredness and fatigue and gastrointestinal distress or dizziness or vertigo or dry mouth or some restlessness and headache, but considerably less than if you were taking the Prozac or the Paxil or the Zoloft. It does cause some photosensitivity. That seems to be the hypericin effect. So that means if you do take the St. John's wort, wear sunglasses when you're outside, because otherwise it seems to increase the incidence of cataracts. And in some people, it seems that it might increase the incidence of suicide or mania or insomnia, and rarely it can lead to a hypertensive crisis or some thyroid abnormalities. It can impair the sperm and the egg activity. It does not seem, however, to be mutagenic, or it doesn't seem to be carcinogenic. It seems to interfere with a lot of other drug metabolites. So when you take the St. John's wort, you have to be careful if you're taking a variety of other kind of medicines, because there is an interaction. It seems that the St. John's wort seems to induce the drug metabolizing enzymes. And because it increases the drug metabolizing enzymes, that means that your body gets rid of other drugs that you're taking much more rapidly. So the kind of medicines that interact with it are birth control pills and Xanax and Zolpidem or Ambien that you might take for going to sleep, or the cholesterol-reducing medicines, the Lipitor and the Crestor, and the antidepressants and the blood pressure medicines and beta blockers, and medicines that control your heart's rhythm, or your calcium blockers, or oxycodone, or even HIV medicines, certain cancer medicines, antipsychotic medicines, anti-diabetic medicines, Parkinson's disease medicines, and even warfarin. So you have to be careful, and you should read the label of the medicines that you're taking if you're considering taking the St. John's wort. And also you should be aware that if you take the St. John's wort and any other kind of product that interferes with serotonin metabolism, maybe you take some tryptophan, or maybe you use the Imitrex or similar drug for your migraine headache, maybe you're taking a selective serotonin reuptake inhibitor, a Paxil or a Prozac or an SNRI or a tricyclic antidepressant. They can lead to the serotonin syndrome. Serotonin syndrome is kind of bad. It leads to change in mental status and agitation, hallucinations and delusions. Can lead to autonomic nervous system instability with flushing and dizziness and increased heart rate, labile blood pressure and sweating, and your muscles can become rigid, you can become incoordinated. Some people have seizures and nausea, vomiting, and diarrhea. So we know it's got significant interaction, so do be careful. And if you're taking the medicine and you decide you want to stop it, well, it might cause some withdrawal reactions, just like with the Prozac or the Paxil. So it could lead to nausea or loss of appetite or dry retching or dizziness or dry mouth. Some people develop chills or extreme fatigue. And we know the medicine's active because when we look at those horses and sheep and cows that are grazing on fields where there's abundant St. John's wort, well, these animals become restless, they start shaking their head and panting and become confused, they run in circles, their skin can become red, they can lose their appetite, become depressed, their pupils dilate, the eyes redden, the face swells, they develop a rash all over. The body temperature goes up, they can lose weight, and they can have significant respiratory and cardiac effects. So, talk about depression. Depression is extraordinarily common. Estimated 350 million people in the world right now with depression. In the United States, 12-month prevalence. About 5% in men, 8% in women. It means about 15 million people here in the United States suffer from depression. We have a variety of medicines. None of them work really great. There's psychotherapy, there's the pharmacologic therapy with the SSRIs, SNRIs, tricyclic antidepressants, MAO inhibitors, and a variety of other medicines. Well, how does St. John's wort stack up to all of them? Well, they did several large studies here in the United States. One of them compared one of the German compounds against placebo. They found that there was no difference. Another one compared the placebo to the Zoloft to the St. John's wort, and they actually found that all of them worked about the same. So the Zoloft didn't work any better than the placebo, which didn't work any better than the St. John's wort. Well, in German-speaking countries, they did some studies. They did the studies in Germany and Austria and Switzerland, and they actually decided that taking St. John's wort for mild to moderate depression was very helpful. They found that it was better than a placebo, actually was as good as an antidepressant, a traditional antidepressant, good as a mitriptyline or imipramine or Zoloft or Paxil or Prozac. Only studied in monotherapy. Typically people who are depressed take multiple drugs. Here all of the studies have been just taking one drug. Well, Pfizer, that manufactures one of the traditional antidepressants, they did a study and they said, no, it's no better than placebo. But there was a study that was done with funding through the National Institutes of Health. They found that when they looked at Zoloft versus placebo versus St. John's wort, they all seemed to provide about the same kind of benefit. And then we have the Cochrane analysis. Cochrane analysis originally from 2009, looking at studies from multiple different trials, looked at about 5,500 individuals and 29 trials. And what they found was that in the larger studies, St. John's wort was about 30% better than a placebo, and in the smaller studies they found it was about 90% better than placebo. And then the Rand Corporation, they did a study and looked at about 35 different studies in people who had mild to moderate depression, and what they found was that depending on the duration of the study and depending on a variety of other factors, it seemed that the likelihood of improvement in people taking St. John's wort was considerably better than it was if they were taking a placebo. And actually, when they looked at remission, they found that the remission rate was as high with St. John's wort as it was with antidepressant. So, yes, there are many different extracts on the market, and yes, you do have to be careful. And unfortunately, there's no guarantee that what you're taking is going to be beneficial, or even that it has any active ingredient, but you can sort of give yourself a little edge. There are several rating companies that provide some sort of clue as to the benefit of the medicine. That's the U.S. Pharmacopoeia and the NSF Foundation International and the Consumer's Lab. So if you look at your bottle and you find it has a stamp that says USP or NSF or Consumer's Lab, then chances are you're getting the real thing. So how does it all stack up? Consumers Report says, looks like it could be as good as this traditional antidepressants, as good as Zoloft and Paxil. If we look at the United Kingdom guidelines, they say, we're not really sure, and we can't be sure because we don't know what the active ingredient is, and there doesn't seem to be any standardization. If we look at the NIH, the National Center for Complementary and Integrative Health, they say there's no conclusive evidence one way or the other. If we look at German studies, we say, hey, the thing seems to be pretty beneficial. So what's the bottom line on St. John's wort? It's certainly inexpensive. It seems to treat mild to moderate depressions. Many studies show significant benefit, oftentimes as good as you would get with the selective serotonin reuptake inhibitors. Seems to be much better tolerated with fewer side effects. Seems to interfere with drug metabolism, so you do have to be careful if you're taking other kind of medicines, medicine for high blood pressure or heart disease or cancer or stomach ailments. But it's not approved by the Food and Drug Administration for any specific medical disease. But in Germany, of course, it's a prescription, and it is used for mild to moderate depression. And as I mentioned before, it's much more commonly used than the standard American type antidepressant. So should you proceed? Well, you got pretty fair reason to consider St. John's wort for treating mild to moderate depression. If you have questions on this topic or any others, especially if you're interested in Prozac or Zoloft or Paxil, or if you're interested in Wellbutrin or many more, you can find shows that we've done on those subjects. And if you find them interesting, well, please subscribe and tell a friend. Thanks for watching. I'm Dr. Ken Landau.